Hello, I want to talk about the issue of tackling weight stigma. It is commonly experienced by people living with obesity, including children and young people, and they commonly experience it not just in the general community or at school or within their family and friends, but they experience it within health systems, health services. And unfortunately, it's commonly delivered by health professionals. It's associated with a whole range of negative social, psychological, and health consequences for people who live with obesity. And it actually makes the situation far worse because people then don't seek help and they don't go to health services, and it's actually part of a vicious cycle. So, what can we as pediatric clinicians do to tackle weight stigma in pediatric practice? Well, most importantly, it's a leadership role. Can we, pediatricians, pediatric clinicians, role model supportive and unbiased behaviours towards people living with obesity? Can our colleagues look at us and say, "Oh, that's a really nice way that you're talking about it. Isn't that a nice way that you're talking with those people?" Can our patients feel that they're supported and encouraged rather than harangued? Can we avoid blaming and shaming people? Think about the language and word choices that you use. Can we use neutral word choices? So, for example, in my culture in Australia, we would tend to use words like unhealthy weight or BMI or having a weight above a healthy weight, or just use the word weight instead of words like obese, extremely obese, or fat. So it would depend on your culture and your language, but what language would your patient prefer you to use to talk about the problem of obesity? It's really important also to create a really safe and welcoming environment where you practice. So just think about the chairs. Can big people sit in the waiting room? Do you have blood pressure cuffs that are big enough to take blood pressure from large people? What about the weight scales? Do they go up high enough to be able to weigh somebody who's big? And where are they located? And can it be done in a confidential, private way? What about the toilets? Can they take big people? What about the gowns or the examination couch? Can they fit large people? Think also about the staff. Are they welcoming? What about the signage too? What are the signs around? What do they mean if you're someone who's big? So, really important, as I've already alluded to, is to have an empathetic approach to behaviour change counselling. Can you support people and go with them on the journey around the issue of weight rather than blaming them and shaming them? So, in summary, language and tone when discussing obesity must be considered. Consider how you can have a warm and empathetic environment for your patients. Your leadership is vital, and think about whether weight stigma is actually embedded in your health service and influencing service planning. But that's a talk for another time. Thank you.